I can say, a very innovative topic, and I landed up with this concept because I myself was suffering from bad breath from a very, very long time. So that led me into a little bit of research and search again in this field, and then I realized, oh my God, so many things we are not aware of. So I'm thankful and thankful to Dr. Abdullah for being such a nice host. So that's me.
Your voice is clear, doctor. Yes,
Well, yeah, yeah.
everything is fine.
Yeah, I'm just
Sorry, just a
the
second.
slide is not moving. Are Abu sir, just check the slide is not moving. Just a second, just a second.
Take your time, doctor. Take your time.
Yeah.
No problem at all.
Now try was that.
Hmm?
Where is that? Where is that full screen?
Aaj.
Engkau yang cantik, engkau yang manis, engkau yang manja, selalu tersipu rawan sikapmu di balik kemelutmu, di remah kabutmu, di tabir mega-megamu, ku melihat dua tangan di balik punggungmu. Madu di tangan kananmu, racun di tangan kirimu. Aku tak tahu mana yang akan kau berikan padaku.
I always like this beautiful song. The beauty of the song is that if you notice, the people are so simple and they are so happy. That is the beauty of this whole song, that there is happiness in simplicity. So we have to make dentistry very, very simple and we'll really enjoy it. And I'm from India basically, and our state is Maharashtra, and I'm from a city by the name of Pune. So we have a very beautiful song which is considered as the heartbeat of our state and our city. So I want all of you all to just listen to it. You may not understand the wordings, but just enjoy the beat.
हे उरत होते धडधड लाली गालावर आली आणि अंगात भरलंय वार ही कीर्तीची बाधा झाली अरे उरत होते धडधड लाली गालावर आली आणि अंगात भरलंय वार ही कीर्तीची बाधा झाली आता धीर झालो यार मग बधीर झालो यार आणि तुझ्याच साठी बनून मजनू माग आलो यार आणि उडतोय बुंगट पळतोय झिंगट रंगात आलं यार झालंय झिंग 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 झिंगट झिंग 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 झिंगट झिंग 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 झिंगट झिंग झिंग झिंग.
That's a very nice number and it was very famous. And that was the heartbeat of our city and state. And now, see, all of us have become dentists, okay? Most of us have become, see, in dentistry, we have observed, especially in my country, that many of times when we don't get into MBBS admission, then we opt for dentistry. So, majority of the dentists are taking up dentistry because they did not get MBBS. Always that little bit of hitch when they join dentistry. But then once we get into dentistry and we see the beauty of it, we really start falling in love with dentistry. Now, my simple question to all of you is that what would you want as a dentist? See, everybody joins dentistry with some dreams and aspirations. They want to do something. They have some aims and objectives in mind. Like everybody has something in mind. I mean, I will tell you that what I would want as a dentist, I would want a clinic like this. See, understand one thing, wherever you are. I mean, the moment you enter your clinic, or the moment you enter the college, or the moment you enter your department or your hospital, if that wow factor is not there, if you don't look forward to going to your college, if you don't look forward to going to your clinic, your hospital, then you need to rethink about your profession. I mean, if you don't have that wow factor when you go to your workplace, I mean, how are you going to perform nicely? I mean, if you're dragging yourself to your clinic, if you're dragging yourself to the college, you're dragging yourself to the hospital, I'll tell you, my dear friends, change the profession. Do something which makes you happy rather than, just dragging yourself. So believe me, I would want a clinic like this and I would want loads of money here. Why not? See, I mean, we would really want to make good money, and dentistry provides us a platform to make a lot of money. So, I would want a wonderful clinic. I would want loads of money coming in, and I would like to treat the who's and who. I mean, I would really like to treat all these people. I mean, would you not also like to do the same? I mean, even you would want to treat the big guys. I don't say that we don't like the unfortunate or the poor people. It's not that, but everybody wants. I mean, just imagine somebody big comes to our clinic. What is the first thing that we would do today? Take a selfie with him and post it on Facebook. So we want a clientele. We want a very good clientele coming into us. Like the who's and who's coming to us. And so I mean, just imagine. I mean, celebrities and their kids. I'm a pediatric dentist, so I look forward to their kids also. And though my topic for today is fresh breath, which is, very not very much connected with pediatric dentistry. It's not connected fully. But I'm telling you, pediatric dentistry, I find it's the best branch of dentistry. I mean, I really just love to be a pediatric dentist. And the kids. I mean, a
Doctor,
parent.
sorry,
Yes, yes,
doctor.
yes,
I'm very sorry.
yes.
I'm very sorry for interrupting, but the participants are asking, can you please, because of the delay of the internet, speak slower? Because there was something like a kind of delay. So can you explain slower? تسمعون صوتي؟ صوتي واضح عني شباب. So doctor, can you hear me?
Yes, I can hear you.
Okay, so doctor, I just wanted to ask you, can you please speak slower, because participants are asking if you can speak slower, please. Okay, because of the delay of the internet.
Yes,
because
yes,
of two things, the delay and the language, you understand, so please slower.
Okay. Yes. Okay. So now, see, I would love to be a pediatric. The beauty in pediatric dentistry is that, see, a person will not spend for himself, but parents go out of the way for their children. And believe me, when you treat children, you are treating, the purest form of humanity. Okay. And then we would love to have the cricketers and their kids too. I mean, in Iraq, I think they would want to have the football players because football is the main game over there. So you would want the who's and who to come to your clinic. I mean, imagine, you would be aware of all these Bollywood actors, Amitabh Bachchan, Aishwarya Rai, Shah Rukh Khan, Akshay Kumar. I mean, we would want them waiting at our reception. Okay, why not? I mean, success is important. Success is very important.
किसी महापुरुष ने कहा है कि कामयाब होने के लिए नहीं, काबिल होने के लिए पढ़ो। सक्सेस के पीछे मत भागो, एक्सेलेंस का पीछा करो। सक्सेस झक मार के तुम्हारे पीछे आएगी। किस महापुरुष ने कहा है?
See, now all of you all are aware this is the movie Three Idiots. Okay. Yes, Mona, what is the thing? I mean, you put your hands on top.
Doctor, I think she's having mistakenly, because we discussed that they will be participating by chat. So sometimes someone who raises his hand, it will be a mistake.
Oh, okay, no problem, fine, no problem. So now here we are looking at Amir Khan. I mean, everybody is aware of it. He's speaking in Hindi. So what he's telling his friend that don't run behind success. Okay, you should not be running behind success, because each one of us wants to be a very successful person. But what he's stressing is that chase excellence. We should be chasing excellence. I mean, today, if you're at your clinic, and the filling that you do, you should feel, okay, this is the best filling that I ever did, or this is the best implant that I ever placed, or this is the best oral prophylaxis that I ever did. See, because if you keep on doing your best, and every day, every patient, you're doing the best, eventually excellence in your work will lead or attract more patients, And when more patients come, your success begins. Okay, so rather than trying to be successful, we have to try to be excellent in whatever we do. I mean, let it be a small filling. I mean, many a times I see, my students also, oh, it's a class one cavity. Are class one cavity it is. Do the best class one cavity that you have ever done. That satisfaction is there. Because remember one thing, when you put in your best, what happens is then you demand the best. Okay. See, many people tell me that in my area, people don't pay me. They give me less money. They bargain with me. See, the reason they do that sometimes is because the way you put it in front of them. Okay. Because if you put it strongly and you're confident about your beautiful work, you will ask, you will not feel shy. So now my simple question is that do you all want to excel in your work? Do you all want to be successful? I mean, do you want? If the answer is yes, then I've got a simple idea. Okay. I'm not here to teach you any specialized dentistry. I'll give you just an idea. And believe me, that idea can change your life. And the longer you stay in the program with me, in the webinar with me, the more you are going to gain. I assure you that. I promise. Now, there is something called as chai pe charcha. You know what is chai? Chai is tea. Now, look at when the chai is served in this kind of cups, how much will you pay for this? Very less. I mean, I don't know how I can connect the currency, the Iraqi dinar, but I can say you can charge, if everybody is okay with the dollar, I mean, we can just charge, 10 cents for this chai or tea. But when it is given in a better cup, we will charge 50 cents. Okay. And when this tea is served with a concept, okay, a tandoori chai, a specialized chai, it's the same chai. The method of serving, the method of preparation, the method of projection change. Now you will charge $1 for this. Then as you move forward, you prepare a chai point, that is a tea cafe. And with this kind of ambience, you're serving tea. You're serving tea. But you can charge how much? Maybe $5, maybe $2. Your charge increases. It is all about presentation. How you present yourself. Presentation is very, very important. We have to look at things differently, a little different. See, do what you have to do until you can do what you want to do. See, I don't say that you start with a hi-fi clinic from the beginning. You might start with a very simple clinic, but as you grow, you update, you upgrade. Because when you have the money, then you will definitely be able to do what you want to do. Now, inspiration can come from anywhere. See these garbage bags. Believe me, my friends, the barbers, okay, the barbers, the ones who cut our hairs, they also share a very similar chair. But with their style and passion, they really make a lot of money.
Kiss me, close your eyes and miss me. Close your eyes and kiss me. I can reach your lips on your fingertips. I can see your smile come on my lips and happiness in your eyes. Kiss me. Close your eyes and miss
Have you felt the new silk? Softer, smoother, silkier. Cadbury Dairy Milk Silk.
Now look at this advertisement. Isn't it wonderful? I mean, looking at this ad, I mean, I don't say Cadbury is the best chocolate in the world, but because of this advertise, I can say that so much sales happen. I mean, many of you all, I mean, if you all have seen this ad, even you would have bought a silk in your car and you would be looking right and left. Okay, it is possible. See, it is how the thing is projected. I mean, just telling chocolate, 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 would you want a chocolate? It doesn't work. Look at the ad. Now look at this.
ओ आखिरी थम्स अप खत्म मैं कुछ और लाती हूँ
कुछ और वो क्या होता है माय लव जो तूफानी होते हैं वो कुछ और का मतलब नहीं समझते हम तूफानी होते ही ऐसे अड़ियल से रास्ते में चाहे कितनी भी रुकावटें आए दुनिया चाहे इधर की उधर हो जाए कुछ और का तो ऑप्शन ही नहीं है हमारी लाइफ में चाहे वो थम्स अप हो या कुछ और मैं हूं तूफानी.
Now look at this. This is a cold drink. But after looking at this ad, we would definitely want to have it. We'll definitely want to have it.
कोलगेट मैक्स फ्रेश में है अनोखे कूलिंग क्रिस्टल जो करे ताजगी का धमाका एक ताजगी सी चली है हवाओं में कुछ बदला बदला सा है फिजाओं में ये दिन है मेरा ये दिन है तेरा हमारा है समा है मेरी ये ज़मीन है तेरा आसमां हमारा है जहां एक ताज़गी.
Now look at this. Isn't it amazing? And see the impact of this advertisement. The impact is tremendous. Have a look at this.
मेरी सांसों में समाओ पास आओ ना
आजमाइए एक्टिव क्लीन माउथ वॉश और माइक्रो व्हाइटनेस की तूफानी ताजगी नए क्लोजअप में ते सबसे ताजी सांसें और सफेद दांत नया क्लोजअप पास जितना बेहतर उतना.
See, if you have noticed, the advertisement of toothpaste are focusing on bad breath. Okay, so that means bad breath is a major problem. Now, we did a small survey. Okay, we interviewed and around 5,000 people. Okay, some of them were college students, some of them were homemakers. Then we did bump into a few celebrities also. There were some cricketers, there were some film actors, and then there were, like artists, musicians, so we labeled them as celebrities. And then we caught hold of entrepreneurs like shopkeepers and, those kind of people with small and middle-sized businesses. And then we contacted the corporates also, okay? The big corporates working in the IT firms, big companies. So we contacted them and we asked them, a list of questions, but the main ones were, have you ever experienced bad breath? Then was it mild, moderate, or severe? And how did you tackle it? Okay, these were the simple questions. I mean, nothing very complicated, to the point. Okay, the focus was we wanted to know what is the awareness level of bad breath. Okay, I mean, are we working in the right direction? Because I started a fresh breath clinic and I was like, am I doing right? So the results were extremely shocking. We were like shocked. Oh my God, 90% people confirmed that they had bad breath. Out of the 90%, almost 2,000 said it was severe. 1,000 said it's like moderate, and 1,900 said it was mild. Okay. And then we asked, another third question was that how did they manage it? So majority of us told them that they sought help from social media to tackle bad breath. Social media means what? Facebook, internet, maybe Twitter, Instagram, TV advertisements, and the hoardings and, things like that. And like I said, didn't you feel like visiting a dentist? So they were like, very few said that they wanted to see a dentist for bad breath because the advertisement clearly showed like Colgate or pick up. They directly felt, I mean, we saw the advertisement and we picked it up. Majority of them. So that was a shock. I mean, because bad breath concerns the oral cavity. And we as dentists are the main persons connected with the oral cavity. And these guys are not coming to us. So that was a shocker. I mean, okay, why the hell are they not coming to us? Because, they said that majority of people who had bad breath, whenever they visited the dentist, the first thing that the dentist would generally do is oral prophylaxis. That means scaling and polishing. And many a times gum surgeries were done. And then they were prescribed mouthwashes and toothpastes. Simple. And even after going through this exercise with the dentist, they didn't, I mean, not all of them were very happy with it. Okay, so then they opted like to the social media. They took on to the online platforms to find out, okay, how do I manage my bad breath? So the problem was that where are we as dentists going wrong? We are going wrong somewhere. Why are they not coming to us? Because there seems to be some lack of information. Now, if you ask me, how big is the fresh breath industry? I mean, see, the question in your mind would be that why should I, as a regular dentist, start something called as a fresh breath clinic? I mean, that's a simple question. I mean, see, today, if I tell you, okay, do implants, you would say, yes, I would like to do implants because there is a lot of revenue. There is a lot of money involved. I mean, you would want to do a lot of endo, everything. But bad breath, nobody has ever thought about it. So halitosis treatment or bad breath treatment market is around $23.21 billion. I mean, that's a big money. Okay. So we as dentists, what is our share? I mean, we need to have, we have to be in it because it is the bad breath is concerned with the oral cavity and that's our area. Okay, that's our area. So, I mean, wouldn't you want to start the first fresh breath clinic in your country? Wouldn't you want to start the first center for exclusive bad breath management? Okay, that should be the question in your mind. With this concept in mind, we move on. Okay, there is a lot of money involved in bad breath management. Big corporates are into making products for bad breath management, but the role of the dentist is not very significant. That is the worrying factor. So now, if you have to be successful, you have to be different. I mean, people should come to, I will visit Dr. Abdullah because he's doing 1, 2, 3 things different than Dr. Muhammad. Okay, people want something different. So the tea everybody is having, everybody is selling, but if they modify it, there is a big crowd. Okay, so you have to be different. So dentistry is just not about implants. Too much focus has been given on implants, so many courses, everything. Implants is good. Then everybody's talking about rotary endodontics, single sitting procedures, and endo. Yes, endo is also very important. Very important. We're not denying it. Orthodontics, there is a big beeline for people to do orthodontics. Then many of the oral surgeons and even general dentists have got into Botox and hair transplant. See, that is something different again. That is something different. That is something wonderful. And it is concerned with the oral facial structure. So we might as well put our hands into it. But still, the number of people getting into this is a little less. Then many are into orthognathic surgery. And of course, pediatric dentists are getting into full mouth GA. General anesthesia is their favorite. But what about the stress? See, all these things are always associated with stress. Remember one thing, the more the complicated the treatment procedure, the more the stress it is. So we want to create a stress-free zone. A fresh breath clinic is technically a stress-free clinic. There is not too much stress over here. And I'll tell you why. And this is a very beautiful thing. Good things come to those who wait. Better thing comes to those who don't give up, and the best things to come to those who believe. Now, bad breath suddenly became popular because of the pandemic. Suddenly, I mean, everybody knows about halitosis. Everybody is talking about halitosis, but suddenly the focus of halitosis has come and increased during the pandemic time. Because what has happened during the pandemic, each one of us is wearing a mask. All our faces are covered. Okay, we are all covered. So what is happening? There is something called as a mask mouth. The mask mouth has been created. Now, while everyone is experiences bad breath from time to time, but since we are wearing the mask continuously and we are covering our nose, what is happening somehow? Okay, somehow we are not breathing through our nose, and a lot of mouth breathing has come into picture. Okay, because the nose is covered and many a times it is blocked like this and you are moving around like this, because we don't want the fogging, especially when you're wearing glasses and especially when you're doing treatment. So what happens is you tend to breathe through your nose, and breathing through your nose is causing dryness of mouth, and it is making it easier for the bacteria that cause caries and periodontal disease to thrive. Okay, and this increased bacterial buildup is somehow helping the production of halitosis. Okay, plus the dryness of mouth, because the saliva, it acts as a buffer, it neutralizes the acids in the mouth. Because there is dryness of mouth, the pH of the environment is raised. Okay, and this decreased pH, okay, favors the growth or protects the bad bacteria. And what happens is once you're wearing your mask, you tend to have a little less amount of water too. Water intake has reduced considerably. And then there is also what is happening, that majority of them are working at home. So snacking and poor nutrition is also taken up. Okay. And plus you can't visit your dentist, so decreased dental care. So all this has compounded the problem of halitosis. So now we have something called as the mask mouth syndrome. Okay. And in this, what you have to do, you have to improve your hygiene. You have to use a non-alcoholic or a sugar-free mouthwash. You have to keep yourself hydrated. And you should have vitamin C rich food in your diet also. Now, the biggest question is, does the toothpaste help to cure bad breath? Because majority of people, whenever you are suffering from bad breath, you tend to brush often. We all have a habit. And see, whenever you brush, you feel fresh. Okay. Now, one simple question.
Washing powder Nirma, washing powder Nirma, दूध सी सफेदी Nirma से आए, रंगीन कपड़ा भी खिल जाए. Washing powder Nirma, दूध सी सफेदी Nirma से आए, रंगीन कपड़ा भी खिल जाए.
Now, what has happened is that almost all the toothpaste contain sodium lauryl sulfate, which is a detergent, okay, and it causes dryness of mouth, and dryness of mouth causes halitosis. Okay, so the big question is, does toothpaste really help to take care of halitosis? That's a big question. Now, most of us are on Twitter, we are on Facebook, we are on WhatsApp, we all enjoy it, okay, but we enjoy meeting our friends more. We like to interact with people. We like to attend parties. We like to meet, because as human beings, we want to interact with a lot of people. We want to move around. We want to socialize. Okay. So when you socialize, you are in contact with each other. Okay. When you're in contact with each other, you're talking with each other. That's the time a lot of air is transferred. Okay. So bad breath is a very, very important aspect if you want to make a good impression. See, if you want to make a good impression, you need to have, your hair should be conservative, combed. You should be well groomed, fingernails, never chew gum, use a good deodorant. Like you have to dress well. But the moment you open your mouth, and if your mouth smells, all other components are finished. This happens. This happens very, very often. Has this happened with you? Okay. Because we say, no, no, as dentists, we don't suffer. Okay, fine, maybe. But this problem is very common. And the issue with bad breath is that you can't tell the opposite person, whether it's your friend or your wife or your parents also. At times, you can't tell them, okay, boss, your mouth is stinking. Because what happens, breath, your odor is something very personal. And you try telling it to your friend, okay, boss, you've got bad breath. He'll say, you have more. They immediately get into the defensive. Okay. And this causes a lot problem. Okay. And it shatters the person's confidence also. Because the moment he opens his mouth, people start doing like this, moving away. His confidence is broken.
The teller's hands, his palms were so smelly, even the money sank. What? But boo, this, but boo. You don't care if you're gore or kale. Why? But
Halitosis is a problem, a big problem, especially periodontists. I mean, chunks of calculus, the amount of stink that comes, oh my God. That's why I'm many times thankful that I'm periodontist. In pedo, the quantum of calculus and materia alba is very less. Oral prophylaxis is not a regular process in pediatric dentistry. Now, can bad breath cause problems? Yes, it can cause divorces also. It has happened. Now, a simple question to all of you all. Why are these Bollywood celebrities, you can say, single? One of the reasons can be severe bad breath. Yes. If you don't get a proper spouse, you know, your proposals are getting rejected. There are people who are facing this problem. It is sometimes because when they open their mouth, the person, oh my God, he stinks so badly. And matchmaking doesn't happen. Then why are these guys married only once? Because they have mild bad breath. Okay. And look at this gentleman. Excellent bad breath, excellent breath can do wonders to you. Okay. So now the biggest question is that, do you consider bad breath as a problem? Yes, it's a big problem. How bad is your bad breath? Now, what is this place which you're looking at? In India, we have got places like public toilets. They're called as Sulabh Shauchalays. Okay. And these places stink. They genuinely stink. And believe me, my dear friends, your mouth also stinks quite a bit. The level of stink in these bathrooms is very high, but in your mouth also it is at the similar levels. Because it is all about volatile sulfur compounds. These volatile sulfur compounds are the compounds which are responsible for the halitosis. Okay. The volatile sulfur compounds are basically hydrogen sulfide, methyl mercaptan, and several related compounds are examples of volatile sulfur compound. Now, what is the mechanism of bad breath formation? How does bad breath form? So now you have surfaces in your mouth like the tongue surface, the throat, the tonsils, the gingival crevices, the periodontal pockets. Now this houses the anaerobic bacteria. And then there is food, mucus, saliva, phlegm, blood, lice, PMNs, desquamated epithelial cells, basically proteins. They interact and they produce sulfur-containing amino acids, which is the cysteine and methionine. And these are broken down into volatile sulfur compounds, which cause the malodor. And they are the volatile sulfur compounds, basically, for example, garlic, sulfur-rotting eggs, cabbage. Now, who all will complain of bad breath? Okay, this is the biggest question. Okay, who all will be suffering from bad breath? Smokers. Smokers are the ones who definitely are having halitosis. And if you notice, the smoker is very much aware that his mouth is stinking. And what does he do after the smoke? He'll have a mint or a chewing gum. 100%. He's definitely going to have it because he's aware that he's having a problem and he'll definitely camouflage it. And then there are people who drink alcohol. Alcoholics. The alcohol causes basically dryness of mouth, and dryness of mouth causes halitosis. Who else will have bad breath? People who are having a majority of dental problems. We all know. I mean, we as dentists, I don't have to discuss all this in detail, but dentists definitely are aware. Dental problems, a variety of dental problems, including dry mouth and oral cancer, will cause severe halitosis. Then there are a variety of medical problems, sinus infections, allergies, various medication. Then you have diabetes, hypertension, and the medication. See, sometimes it is the disorder which causes the halitosis, or it is sometimes the medicines which are taken cause the halitosis. Now, this is a very simple mechanism. The anaerobic bacteria, especially when you have a common cough and a cold. Okay, favorable environment, the mucus, the phlegm which is there is loaded with bacteria, it's loaded with protein, and it produces hydrogen sulfide, that is methyl mercaptan. Who else can have bad breath? The people who are into professions like teachers. They're talking continuously. They're having dryness of mouth. Then call center executives. Okay, people who are working in corporates in nice AC environment, they have a lot of dryness of mouth happening. They're talking. Good morning, sir. Good evening, sir. Bank executives, where they have to keep on talking with their customers. So dryness of mouth and bad breath has a major connection. Because the saliva is very, very important. It moistens and cleanses the mouth by neutralizing the acids which are produced by the plaque containing bacteria. Okay, and washing away dead cells that accumulate on tongue, gums, and cheeks. Yes, Hatim, how are you? He's from Africa, if I am not mistaken, Hatim, right? Nairobi. Yes, so saliva causes, it helps in neutralizing the acids produced by the plaque and washing away the dead cells that accumulate on the tongue, gums, and cheeks. And if these aren't removed, the cells decompose and cause a lot of bad breath. Then what are the signs and symptoms? What will be the complaint? How will you know that the person has dryness of mouth? He'll have difficulty in swallowing. He'll have difficulty in chewing. He'll have difficulty in speaking. And there will be the tongue. There'll be a white coating on the tongue, dry, cracked lips, and of course, there will be bad taste in the mouth. Anything you give when they eat, no, it's not so good. It's not so good. They'll keep on complaining. The food is not tasty. The food is not tasty. You have to check out whether he's got dryness of mouth. Now, what are the various causes of dryness of mouth? Because see, dryness of mouth is the key. Majority of things, majority of illnesses, medications, and medical conditions cause dryness of mouth. And there are a lot of medications also. So you have blood pressure medications, antihistaminics, antidepressants, diuretics, NSAIDs. So if you're taking a painkiller, be assured you've got bad breath. Then there is, of course, depression, anxiety, allergies, diarrhea. Diarrhea, again, there is loss of water. And then there are a lot of extraoral causes, as we discussed. I mean, the disorder and the breath will be very much connected. In diabetes, you will have a fruity acetone odor. When there is liver issues, you'll have a sweetish, musty odor. In acute rheumatic, you'll have a kind of acidic sweet. Lung abscesses, it's very stink. I mean, it will look like, what do you say, pus kind of a smell. Then in liver cirrhosis, decayed blood. In uremia, ammonia type of smell will come. So various disorders will have a typical smell. I mean, you have to face, as dentists, we might not land up with these kind of things so easily. But when the patient complains of bad breath, in the history taken, we have to check about the medical aspect, because the moment the patient comes with a complaint of bad breath, majority of us, the first thing that we do is oral prophylaxis. And then we are looking for gum surgeries. Then we prescribe a mouthwash, maybe an astringent, and a toothpaste. And that's about it. We have never checked the underlying cause. Okay. So many a times disorders can be detected with the hair if you are able to detect the reason for bad breath. Then there are many foods. There are a lot of foods which are rich in sulfur, like onions, garlic, fish, eggs. These are all bad breath producing foods. Superb amount. I mean, you have an onion and you stink. You have a pot of garlic, you have your garlic naan, and you have garlic like in your food, and you will definitely have, because they're loaded in sulfur. The bacteria break down the food products, the proteins, to produce volatile sulfur compounds. And here you are giving sulfur direct. So the smell is going to be there. And milk products, your chai, your coffee, your cheese, everything, everything will promote halitosis. And stress, of course, because stress causes dryness of mouth. So that is one reason. And in stress, what happens? We bump into, you might have experienced during your exam times, whenever your exams are there, you want to have a chocolate, you want to have ice creams, your craving for sugar increases. And if your sugar intake increases, your bad breath definitely is going to rise. So now bad breath, we can classify into 4 specific categories. See, because understand one thing, why we should know so much in detail, because we are bad breath specialists. You have started a fresh breath clinic. So if you have started a fresh breath clinic, you have to know everything about bad breath. You have to tell the patient, boss, this is your reason. This is your reason. This is your reason. You have to be perfect. So there is pathologic bad breath. Then there is something called as transitory bad breath. Then there is physiological bad breath, and there is something called as halitophobia. Now, what is pathologic? Pathologic means there will be a known pathology, dental or medical. Okay, so you have to get into history. See, when a patient comes with a complaint of bad breath, I mean, you really have to spend, I can say, 1 hour with the patient discussing his history, because then only you can suggest him solution. Otherwise, you will not be able to. See, that's why in the survey you found out, now people prefer the media, social media, for their management of bad breath and not the dentist. Is because they are never satisfied with the options, because let it be Dr. X, Dr. Y, Dr. Z, the protocol for bad breath is oral prophylaxis, management of gum disease, and then mouthwash and toothpaste. So he goes from dentist to dentist, he gets the same aspect. And we learned in the beginning only, most of the toothpaste contain sodium lauryl sulfate, which is a detergent, it is a soap, and it causes dryness of mouth, and it is responsible for halitosis. Now you try it yourself tonight. Tonight, what happens after you brush? Tomorrow morning, observe what you do after brushing. See, after you have brushed your teeth, you will notice that you have the urge to drink a little bit of water. You will want to have water, because your toothpaste, because it contains that detergent, because it contains sodium lauryl sulfate. Check for the content, boss. Today, as dentists, we don't know the toothpaste. How many of you all have actually, went through the contents of the toothpaste? Rarely we do that. Majority of time we are prescribing, yeah, you have this toothpaste, this toothpaste. Many a times there's no logic behind it. Read, okay, why after brushing in the morning you feel like drinking water? Even in the night when you brush today, you see that after you brush, you have that urge to have a sip of water, because it is causing dryness of mouth. Then there is something called as transitory bad breath. Now, transitory bad breath generally occurs and it lasts for 24 to 72 hours post your meals. Okay, it stays because of this lovely foods that we consume. Then there is something called as physiologic bad breath. Each one of us has a tongue. Now, tongue is a grassy lawn. It's a grassy lawn. So anything and everything that you eat stays back on the tongue. Okay, you have milk, it stays back. If you have a juice, it stays back. Whatever. So tongue harbors a lot of bacteria, and this harbors a lot of food. It gives a surface for the food, a resting place for the food. The food interacts with the bacteria. There is breakdown, and volatile sulfur compounds are produced. Check your tongues, my dear friends. If your tongue has a coating, be assured you've got bad breath. Be assured. Only the levels will vary from person to person. Then there is something called as halitophobia. Now, many patients have this issue. After you have done a proper bad breath management, they still feel, I'm so sorry, they still feel that they have halitosis. What is the reason behind it? Because see, sometimes what happens, when you have a problem, You're always aware of it. Your focus is on that. Okay. So now if your 10 people are talking to each other, okay, and when you say, okay, this, and one person does like this, what do you feel? Oh my God, because of my bad breath, he's doing this. See, I might be feeling scratchy on my nose, boss, but since we are aware of that problem, he'll still feel it. So in these kind of patients, when you have given them a proper halitosis management treatment at your clinic, and you have given all the home remedies, I always give them a pocket halimeter. Okay, whenever you feel you have got bad breath, check it. So once you check it, oh, they realize, okay, it's not there, or it is less, or it is more. So giving them a tool to use it in the house is very, very critical. Okay, you just can't say, no, I'm telling now, because I'm telling you're cured means cured. No, everybody wants a proof. And bad breath is the air in the mouth here. So it is a little tough for the patients to believe that he's cured. So then everybody has a tongue, and 90% of the oral cavity is occupied by the tongue. So the conclusion is that each one of us suffers from bad breath. Only the intensity will vary from person to person. So now there are certain myths about bad breath. Okay, like concepts. Some say acidity. Acidity. If I've got severe acidity, that means I've got bad breath. I mean, where is the connection? In acidity, you feel the burning sensation. You don't feel something coming out. You don't see a fume coming out. I mean, a person who's having acidity, he doesn't look like a smoker with fumes coming out from the corners of his mouth. Nothing of that sort. It's a feeling. Acidity is a uncomfortable feeling. There is no release of gases. Then stomach problems. See, if you have stomach problems, the exit area is different. How can it be connected? Many say if you're constipated, you'll have bad breath. No, 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 no. There's no connection. For constipation, you require something else. You require a laxative. And the matter is taken care of. So only if the patient is suffering from something called as hiatus hernia, where the gastroesophageal sphincter, like after you have your food, there is a gastroesophageal sphincter. It closes. It's an airtight sphincter. If there is hiatus hernia, the control of the sphincter is lost and there is regurgitation of the food outside. In that situation, bad breath is connected with the stomach. Now, how do we test bad breath? Ask yourself. Everybody say, they'll keep on spelling the nose. How can you pull the air out and smell? It's difficult. The simple exercise is take your finger, take your hand, lick it. All of you all can do this exercise because it's an online thing. Quietly, I mean, your video is already off. Just lick your hand. Wait for 30 seconds and smell it. That's the intensity of bad breath that you have. Or take a floss. Wherever a food is stuck, remove it and smell it. That's the intensity of bad breath that you have. Or have a look at your tongue. If you see a nice white or yellowish layer on it, be assured that you've got bad breath. There's no way out. And of course, the Shah Rukh Khan way is there. Ask your spouse, ask your friends, boss, does my mouth stink? Because in this close proximity, you can definitely know how bad is your breath. Very simple. And of course, there are scientific ways also. There is something called as a halimeter. A halimeter is a device which gives us the level of volatile sulfur compound. It definitely gives us the quantity of volatile sulfur compounds. And from that, you come to know how bad is your bad breath. And what are the other symptoms associated with halitosis? There'll be bad taste, there'll be bleeding gums, dry mouth, feeling of stomach or heartburn. Many people complain of this. This is just parallel with it. A feeling of foreign body in the throat, accept it. There'll be a coating on the tongue. Then there will be a post-nasal drip when you have a cough and a cold. And of course, periodontal disease. If you have a gum disease, there is bleeding gums, be assured that you are suffering from bad breath. And then there is something called as a pocket halimeter. Okay, very, very simple device. You just have to blow air onto it and it will give you a reading. No odor, slight odor, moderate odor, and strong odor. So we have a lot of these devices. Whenever we are managing any patient, we give one to him. And these days, with these things available online, we can always prescribe. They easily are available. They're not so expensive too. The patient can keep on measuring and manage. See, bad breath cannot be cured. It has to be managed. It has to be managed. But device is important. Because see, you can't say by looking at somebody, okay, oh, he's got anemia. Oh, his hemoglobin level is low. Okay, but you should know the reading. Okay, and then you do some management. You give him some medication. Ah, Kisi, now your hemoglobin is right. He will not believe, okay, my hemoglobin before treatment was, say, 11. After treatment, it is 16. So that is the difference. So a physical and an objective parameter is required. And a halimeter is a must when you are having a fresh breath clinic. So now, does anybody know the treatment of bad breath? Yes. As dentists, it's our area. Oral prophylaxis, gum surgeries if required, and of course, mouthwash and toothpaste. Now, how do majority of people manage their halitosis? Most of them carry a lot of mints and chewing gums. Most of them. Every woman's purse you remove, she will have a polo. She will have those, halls and Mentos and Center Fresh. All this is definitely there. And if this is there, be assured that the person knows that he or she is suffering from bad breath, and that's why he or she is having it. And all the stores are loaded with these things. And we pick up very, very quickly. Any purse, a woman's purse may mouthwash, and these days hand wash, of course, and hand sanitizer is definitely there these days. But these kind of mints and chewing gums will definitely be there. Now understand one basic concept. Like these mints, chewing gums and all, they just give that temporary effect, especially the sugar containing. It's just the flavor in the mouth that makes you feel good. It is like not having a bath for a week and just keep on applying perfume. The stink is inside. You're only masking the odor, only masking it. Okay. So that is of no great help. So many are available. Wrigley's, Orbit, many. There are sugar ones and sugar-free ones. Both varieties are definitely available. Fresh breath strips are available. You name it and they are there. That's why I told you it's a multi-billion-dollar industry, because every company knows that these things are in demand. And you as a dentist are not participating in it actively. That is the sad part. You should go through the content sometimes when you pick up a polo, when you pick up these mints. I mean, you'll be surprised. So much sugar. I mean, look at the amount of sugars. Everything that is not good is there. And sometimes they're available so cheap. So I always get scared. The cheap it is, the more scared I get. So now we come directly to the management of bad breath. Because see, now in bad breath management, the important thing that now you know the diagnosis. Okay, this is what is there, and how are you going to manage it now? Okay, so in the management, in the first appointment in your fresh breath clinic is going to be very, very long. Okay, and understand, my dear friends, the main reason that I'm interested that you should think about starting a fresh breath clinic is because you will change the complaint. Now just imagine yourself, a patient comes to you with a toothache. Okay, this particular tooth, the lower molar is paining. You open his mouth and you see a variety of things in their mouth. You see missing teeth. You see periodontal pockets. You see gingival inflammation. So many things are there. And you say, wow, he needs a full mouth rehabilitation. But his focus will be, please manage this tooth. Okay, that one tooth. And after that tooth is managed, see, we have faced this very often. Whenever a patient has come with a severe toothache and we have done his root canal opening, access opening is done. After that, almost I can say 50% of the patient does disappear. Why do they disappear? The pain is gone, everything is gone. Okay, and then they come back again when when the pain begins. See, because understand, my dear friends, dentistry, people don't love to visit a dentist. Everybody is scared of the dentist. But by starting a fresh breath clinic, what are you doing? You are changing the chief complaint. The complaint of the patient is halitosis. So for halitosis, you need to do, you need to, like take care of his gums. You need to take care of his rotten teeth. You need to take care of his missing teeth. You need to take care of everything. So everything, replacing a tooth also is a part of bad breath management. Because see, if there is a missing tooth, ultimately it will lead to a periodontal problem in the adjoining teeth. So we have changed the chief complaint. So that's why my stress is that a fresh breath clinic opens up your, like clears up, it gives you more area to work on. So in the first appointment, what do? We do a detailed intraoral and extraoral examination. Okay, detail. And then you take his medical history in detail. And if required, you can have a word with his physician also. Go through the list of medications he is required. Because see, what happens many a times, it is not necessary when you see a patient with gum problems, periodontal disease, missing teeth, decayed teeth. So you have a reason to take care of that and manage the halitosis. But many times you'll have absolutely clean mouths. Absolute clean mouths. You don't even require an oral prophylaxis. And he says, can I have a complaint of bad breath? So if one of the causes might be that he's maybe a call center executive or his consumption of water is less. So dryness of mouth is his problem. So that area needs to be focused on. So it's not always the gum, or it's not always the oral prophylaxis, which is a very common trait. So medical history has to be taken in detail, and bad breath testing has to be done with the halimeter, either the pocket halimeter or the big halimeter. And then dietary history is very, very critical. Okay, what is he eating? What is he having for breakfast, lunch, dinner? What is his in between meal snacking habits? Everything you need to know in detail. Each and every minute is detailed. And finally, you'll have to give him a plan. So in one aspect, you will give him a dental treatment plan. Okay, where he need to do maybe the replacing the missing teeth, maybe, like tackling the oral gum disease, periodontal disease. A variety of things has to be taken care of. So that is your dental treatment aspect. The second aspect is oral hygiene ke liye, what all products will you give him? Which toothpaste you will give him, which mouthwash you will give him, which mints you will recommend. Everything. You'll have to technically give him a proper kit. Okay, see, this is what you're going to use. And then diet counseling. How he eats, what he eats, when he should eat. You are totally involved. So when you are a fresh breath specialist, you become technically a very, very big consultant.
ये आपके guess है?
This is a very common buffet in marriages.
ये यहाँ क्या कर?
एक second.
In buffet, generally we have lots of things.
Very good. अबे पूरी के लिए जगह नहीं है. Adjust कर लेना side में. अच्छा.
Hi.
Hey. Hi.
आपने मेरी आंखें खोल दी.
ग्लास में लेना.
अरे ऐसी क्या बात है? तो मेरा फर्ज था.
Can I ask you for a little more help?
या.
मेरे डैड सुहास के साथ ये एंगेजमेंट तोड़ने नहीं देंगे. आप इतना अच्छा एक्सप्लेन करते हैं. अगर आप उनको भी एक डेमो दे दे तो.
हाँ क्यों नहीं डेमो देंगे. राजू हाँ चटनी दे.
You're really sweet.
अरे कहाँ है डैडी आपके?
बिल्कुल आपके पीछे.
Buffets, whenever we go for weddings, look at the variety that is being served. This is the variety in Iraq. It is amazing. Amazing food. Look at the amount of sweets that are being served. Amazing. And then we say dental problems will happen, not happen. Definitely they're going to happen. Then we have the dates. Normal dates are very good. But then what we have done, chocolate dates. Dates with, fillings and stuffings. All that has happened. And in an Indian scenario, Okay, in the buffet starts with a starter and a soup, then the main course, and then the sweet dish, and in the end we have the desserts and pan also. So having sugar after main course will give, what will it happen? It will definitely give a lot of bad breath. Then cold drinks. We all are fans of cold drinks. Energy drinks. Okay, are they good? Think about it. So, see, people will say, "No, we will eat whatever we want. Please don't stop us." See, so your idea should be that you eat what you want, but towards the end, you eat the way I want you to eat. So we have to break the sequence. Now, there are certain fruits which promote bad breath. This is, custard apple, mango, chiku. They are, fruits with a lot of milky base. So they stay on the tongue. So they will cause a lot of bad breath. So you should ask them to switch over to fibrous fruits like apples, cherries, citrus fruits. Because the fibrous fruits, what happens? They increase the salivation and they wash away a lot of debris that are present in the mouth. And then, of course, we have stuff like ginger, cinnamon, avocado, apple cider, green leafy vegetables, and we have our cardamom seeds, guava leaves. These are natural remedies. Look at this cucumber.
Cucumber, or as they call it in Jamaica, cucumber. Cucumber. Vitamins, minerals, very high number. Silica, hair and nails get longer. Other vitamins make your bones them stronger. Anti-wrinkle make you look younger. 95% water. Kidney cleanser, great hydrator. Detox, fiber, good regulator. Give your body good things, don't be a traitor. Get the cucumber, cut it in a slice. Put it in a jug of water overnight. You know what you get for a fraction of the price? Energy drink full of electrolyte. Roaring salad is one of the use as a base for your vegetable juice. Another surprise, put a slice on your eyes, take away the dryness, revitalize. Oh yes, one thing I have left, cucumber can also help with bad breath. Wash away the bacteria that cause the odor. Cucumber water instead of soda. A Maccabea Medical Monday. Cucumber.
See, simple fruits, cucumber. I mean, would you believe it is so wonderful? So now, in the dietary advice, we have to actually tell, stop crap, boss. This is all rubbish, which we are consuming. This is how a pharmacy looks like. This is an actual pharmacy. Then we have roadside vendors sending good food, and we have civilized society selling poison. So now medicine is not healthcare. Food is healthcare. Medicine is sick care. And a hospital is not a healthcare unit. It is a sick care unit, actually. So now these are homemade remedies for bad breath. See, this all you need to prescribe to the patient. Okay, you need to have fennel, you need to have cinnamon, and all these things are available. In the subsequent slides, I will tell you how are we going to use these particular things. Now, 10 foods which help to fight bad breath. They are basic foods, and you have to recommend it to each and every patient. Green tea. Green tea is definitely very, very good. Abdullah, Dr. Abdullah?
Yes, doctor, I'm here with you.
Should I continue or we'll go to the next part? I mean, should I continue for some more time or what is your suggestion?
I will take the opinion of the participant. What do you think? زملائنا الاعزاء انه الويبينار بجزئين، تحبون انه نخلي الجزء الثاني اللي يكون بتفاصيل اكثر غير يوم؟ كتبوا لي ارائكم بالتعليقات، لان الجزء الثاني هو نوعا ما مركز، فاذا تحبون نكمل او ونحن نمشي على راي الاغلبيه يعني. بس البقيه خلي يكتبون الكل، حتى خلي الكل يكتبون حتى راح نعتمد على رايكم. اتمنى انه الكل تشارك، يعني يا ريت لو الكل تشارك، الكل. والله بصراحه يعني دا اشوف 90% دا يقولون انه يوم ثاني، يعني يا 90 اكثر من 90 يعني بعد خليني اشوف. يوم ثاني والله مش احسب بس خلينا نشوف الاغلبيه. Doctor, can I ask, what is the highlights of the next part? What will be speaking?
This is
I think
see the highlight will be all the products which we are going to recommend for bad breath, which all toothpaste, which all toothbrushes, which all tongue cleaners, which all mouthwashes, which all mints. I mean, it's going to be an hour, almost a 70 to 90-minute session fully, because so
70.
much
Okay,
information. Okay, yeah.
Doctor, I think you understand. If you have a little Arabic, participants are indicating that we need it in another day to be more focused on this. So
Yes, yes,
okay,
yes, yes.
okay.
So what will we
Doctor,
do
I
next
just
time? Yes, yeah.
okay. So what about tomorrow? What do you say about tomorrow at the same time or another day? What do you think?
Yeah, tomorrow or maybe Monday. By morning we can decide. You can ask everybody because it's a Sunday. So I mean, it's up to you. I mean, you just tell me either
So
tomorrow or day after.
Monday.
Yes, Monday
اوكي
in the
سو
night.
ماندي
Yes.
تونايت زملائنا الاعزاء ان شاء الله يوم الاثنين مساء راح يكون الجزء الثاني من المحاضره تمام وهسه اكو دكتور I just received the questions would you be able to answer now
Yes.
اوكي زملائنا الاعزاء اذا راح يكون التكمله هي يوم الاثنين في نفس الوقت ان شاء الله حاليا سؤال اللي عنده اسئله يكتبها دكتور there's a question from Dr. Zainab. Dr. Zainab is asking she's a student, she's a final year student. She's saying about I think she's asking about the first part of your webinar. She's asking what should I do as a student to improve my chances when I will be graduated to be an excellent dentist or a special dentist. So what is your advice for a dental student?
See, for dental student, if they get to do specialization, nothing like it. Because becoming a specialist, it gives you more focus in one area. Say, for example, if you become a pediatric dentistry, you have to focus on that area. So it's always good. So if you have an opportunity, you should always study further. Because the more information you have, the more better it is. It's always that way.
Okay, doctor, another question is from Dr. Sarah. Dr. Sarah is asking, I want to ask you, doctor, if mouthwash cause pigmentation in teeth or not, and which type should be used that not be harmful to the teeth?
Yes. See, now, for example, most of the chlorhexidine-based mouthwashes, they cause staining on the teeth. So they are supposed to be used only for 2 weeks, 3 weeks, or maybe 4 weeks. So that way, many other that's what in the next part, I'm going to talk about a lot of mouthwashes also. Okay, which mouthwashes you should use for which condition. See, for gum problem, you should, and there is a fixed duration for a mouthwash. I mean, you can't use the mouthwash all your life. You have to use it for a short period and then discontinue. People and chlorhexidine-based mouthwashes, you just cannot use it for more than a month. Otherwise, staining of the teeth comes. And then staining of the teeth means that it will accumulate more plaque.
Okay, doctor, another question is from Dr. Zainab. Dr. Zainab is asking, doctor, should I advise the patient to drink water after dental face or not?
See, you will have to see, today you experimented yourself. See, all of you all will be brushing your teeth in the night, right? After you brush, see, today, two exercises you do for yourself. Okay, one exercise is that you first read the contents of your toothpaste. Because see, today, if I ask you which toothpaste you're using, what does it contain, and why are you using that particular toothpaste? There's a big problem. I mean, we just use because somebody is telling. I mean, Colgate is advertising, so we are using. If whichever big company is advertising, we are using. We rarely read the content. I mean, every toothpaste has a content. So today, what you do is that tonight, you read the contents of your toothpaste. And after brushing, you just check what you feel. You will you will want to drink water. Because if your toothpaste contains sodium lauryl sulfate, you will have dryness of mouth and you will definitely want to drink water.
Okay, doctor. So I think now we will end today and we will be with you Monday, inshallah.
Yes.
It's okay,
Thank
doctor?
you so much. Yes, 100%. So on Monday, we will start again. Yes.
Inshallah. Thank you so much, doctor. And in my name, all my fellow dentists, and in the name of Iraqi Dental Association, we will be so happy and we are very happy to host you. And we would like to thank you so much for what you presented today. Thank you so much.
Most welcome. I hope I didn't waste your time. I really hope I didn't waste your time.
No, of course not. You can see, doctor, there are a lot of interactive messages and everyone is happy. So thank you, doctor. See
Thank
you
you.
inshallah
Thank you
on Monday.
Okay. Thank you so much.
inshallah. Thank you,
Okay.
doctor. زملائنا الاعزاء ان شاء الله راح يكون لقائنا بكم يوم الاثنين القادم، وشكرا جزيلا لكم على متابعتكم. تابعوا صفحه المكتب الاعلامي نقابه اطباء اسنان العراق للتفاصيل الكامله. مع السلامه.
Okay.